All right, Larry, you and I have launched our YouTube
Hello.
channel. There's a number of videos there already posted,
There are.
and it's highlighting a lot of work that you've been doing, combing through the FDA's MAUDE database, or the Medical Device Adverse Event Reporting database that
Exactly.
the FDA's houses. And in these videos, we are talking a lot about under-recognized and potential risks of gastroscopes transmitting multi-drug resistant
Such
organisms.
as
And
CRA.
so, such as CRE, absolutely. And you've done a number of studies, and they can find those studies on the blog. You can also
On my
learn more
blog.
by going to the YouTube channel. But we're going to introduce a new case today, which is a gastroscope linked to a deadly fungus. This goes back to December 2022, and you
Just a few months ago.
identified just a few months ago. So why don't you tell us a little bit more about that?
So, as listeners know, I do exhaustive reviews of the FDA's adverse event database, and I look specifically focusing on flexible endoscopes. I look for cases that would catch our attention and might require us to adopt and implement a new type of mitigation or a recommendation to prevent infections. And there's been this fungus called Candida auris. It's very deadly. It's generally multi-drug resistant. It is readily transmissible in the healthcare setting. And if you get infected with it, you can have a mortality rate of 40% or more. So it's associated with
Wow.
significant morbidity and mortality. So when I was going through the FDA's database, I found a report talking about a patient who had been exposed to a gastroscope and then shortly thereafter cultured positive, which can mean either infected or colonized with this Candida auris organism. And I had not before found, in my years of research, any reports in the public literature or the MORD database associating the use of a flexible endoscope in general, and in this case, a gastroscope in particular, with a possible transmission of this life-threatening, deadly fungus, Candida auris. So I wanted to bring that to the public's attention, talk a little bit more about its epidemiology, and then provide some recommendations to help listeners improve the safety of their patients.
So we'll be getting into that in kind of a three-part series with the videos, but I do want to ask you a couple of questions. One is, obviously we've highlighted potential issues with reprocessing. There's been challenges, for sterile processing and other folks working in GI that are reprocessing the scopes, that sometimes the instructions for use can be pretty lengthy, and there can be a little bit of an oversight in reprocessing and the steps that are involved,
Right.
especially with newer staff. It's kind of a training thing. Were there any reprocessing errors described as part of this report?
No, there weren't. And I will say, to digress very briefly, that the FDA is, to your point, about these multiple reprocessing steps and human factors issues that some of the listeners are aware that with duodenoscopes, the FDA has now been transitioning the community to those with disposable components, such as a removable end cap, that not only simplifies reprocessing, to your point, but also enhances reprocessing. So this is the first time that we've seen this with the Candida, and it's beyond the scope of this presentation to talk about everything to do with Candida and disease transmission. But we wanted to bring this to the public's attention, and I think it's important because there's some recommendations and some guidance we can provide. So, and we will begin talking about exactly, well, a little more about what is Candida auris and some of its epidemiology. That's what we're talking about today. And any other questions that you have, Justin, I can answer, and the audience listening can get much good information out of this.
Yeah, we're going to stay with us. There's going to be some more videos. As Larry mentioned, on our next video, we'll be talking about Candida auris and going into a lot more detail, as well as talking about some of the risk factors that may have also played a part in this particular report that we're highlighting. And then in the third video, we'll be talking about some guidance and drawing some conclusions there. So make sure you check out the future videos, and we'll see you all soon. Don't forget to check out the YouTube channel.
And in those future videos, in closing, we're going to focus on modes of transmission of Candida auris, how this is relevant to the gastroscope, and what procedure in that FDA report was being performed in addition to exposure to the gastroscope that may have played more of a role than the gastroscope in transmitting infection, but we just don't know. So stay tuned.